Hello, ladies and gentlemen. Good morning. This is Dr. Sohail Chaudhry. I'm one of the interventional cardiologists in Vansco, Richmond Market. My main area of practice are cardiovascular medicine. In addition to cardiology or heart diseases, I also take care of patients with vascular disease or poor circulation into your legs, or blood clot, or varicose veins, leg swelling, venous ulcers. This morning we'll have a very general conversation about cardiovascular disease and health, and it's an open forum, so please don't hesitate. Send in your questions. Vansco has been marketing for this live Facebook streaming for last few months, so we have few questions over last few days, so I'll be answering those questions, and as you send in more questions, I'll be more than happy to answer any of those issues that you're having at home. At the same time, during this whole podcast, if you have any concern or questions, you can also go to our website, bonsecourse.com, which gives you more information about how to contact our physician and our cardiovascular team, and have multiple resources and education for general public. We are doing this because of the cardiovascular disease is so common in general public, and especially nationwide and also worldwide. It's the number one cause of mortality or death and the morbidity in patient population that we deal with, and that's why there's so much emphasis on the cardiovascular disease. And since the vascular disease and the cardiac problems, they share a lot of underlying disease pathology, and the mechanisms and treatment are very similar. That's why you have me here today, talking not only about your heart disease and the risk factors, but also talking about vascular disease or poor circulation in your leg. Coming to cardiovascular disease, heart disease is the number one cause of mortality. There are patients who normally develop a heart disease. There are certain risk factors that we look for. And due to high prevalence of these risk factors in the general public, that is one of the reasons is that a lot of us, we suffer from cardiovascular diseases. It's important when we talk about cardiology from a risk factor perspective. Patients who have high blood pressure, high cholesterol, diabetes, smoker, family history, male above the age of 55 or female above the age of 65. These are all the risk factors that increases the risk of developing heart problem, heart attacks, peripheral arterial disease, or poor circulation in the leg. And when we manage patients with a cardiovascular disease, these are the risk factors we normally focus on, how to control them and then take care of these patients. The number one, also the cardiac diseases are very important in female patients. That is one area where we are really focused on because historically, I would say that female population has been underserved with respect to cardiovascular disease, and there are many reasons for it. One of the reasons is that the cardiac diseases or heart disease or heart attack presents in a very atypical manner in female patients. They do not necessarily develop the typical symptoms of chest heaviness or chest pressure, what we normally call angina, or they may just have a little bit feeling fatigue, they may have a little bit heartburn, a little shortness of breath, and that can be a very subtle sign of the underlying heart problem. And also, the prevalence of diabetes and high blood pressure and high cholesterol is underestimated and underdiagnosed in female patient population. That is another area that we want to make sure that message goes out to the public, is that especially our female patients, they pay special attention to these vague and very subtle signs and symptoms. And don't hesitate to contact your physicians or your family doctor or your OBGYN. In what shape and form you come in contact with the healthcare professional, seek attention. When we take care of these patients who have cardiovascular disease, another important area, which is very important along with the risk factor, is to how we can prevent it. And that's where, along with the risk factors, the role of exercise, quitting smoking, healthy lifestyle, eating healthy food is very important, because we've been hearing about this all our lives since our school time, is that prevention is the best cure, and that probably holds very true when it comes to the cardiovascular disease. So it's important that we take care of all these risk factors, lead a healthy lifestyle, and take these subtle signs and symptoms very seriously. And if anything comes up, just don't hesitate to get attention. It's never too late. With respect to how the cardiovascular disease can prevent heart patients, as we know, you can have a chest pain, you can have shortness of breath, have a little bit of heartburn, palpitations, lightheadedness, dizziness. With respect to vascular disease, you may have leg heaviness, leg cramps, restless legs, skin discoloration, skin breakdown, loss of hair on lower extremities. You may, in extreme cases, can develop ulcers and wounds. These are all the symptoms that we should look for, and if you have any of those symptoms along with the risk factors, then probably we should take it more seriously and pay attention to it. I do have some questions which came through online. So one of the questions is, what is Heart Check Challenge? And I think this is in respect to one of the online source which Bon Secours has it, and I'll explain a little bit to you, but you can also get more detailed information from our website at bonsecours.com. It's primarily an online resource for patients and general public and their family, where you can take a small questionnaire to get an idea what is your risk of developing a cardiovascular disease. It also gives you a site where you can go and get your heart scan, or in other words, a coronary calcium score, which is a screening test to look for a buildup of plaque at very early stages in our heart arteries. And thirdly, it gives you access to a directory of our physicians who you can contact online and set up an appointment.
Here's a question that's come in. Are varicose and spider veins a sign of poor circulation?
So just changing gear a little bit, I think the question is varicose and spider veins. This is a disease of a circulation problem which is unrelated to traditional cardiovascular risk factors. When we talk about a circulation, strictly speaking, we have to understand that there are two pieces of this puzzle. There is God has given all of us these types of blood vessels which take blood from the heart to the target organ, and then the blood is supposed to come back to the heart through another set of blood vessels. And the analogy sometimes I use to explain it to my patients is, think of this as a water supply line and a sewage line. So if the question of varicose veins and venous disease is where the blood flow into the leg is fine, it's more so a problem with the blood flow back to the heart. And that generally does not happen because of the plaque buildup of a cholesterol. It's more so in patients if you have a previous blood clot, which can damage the vein valves, and blood has a tendency to pool in a leg, and being in a dependent position and a difficulty of a poor blood flow back to the heart over time, that pressure buildup in our legs can cause these varicose veins and spider veins. And yes, they can be a sign of underlying poor circulation, but you have to also look at those spider veins and varicose veins in the context of other symptoms. If you have leg cramps, if you have restless legs, leg throbbing, aching, leg swelling, venous stasis, or skin changes because of the prolonged venous stasis, then that spider vein and varicose vein could very well be a sign of circulation. And at that point, with those symptoms, I would recommend that you should seek medical attention, and difference in treatment, with treatment difference can be made. There's another question they are asking about why is it important to get a heart screening? I think it's coming back to what I said earlier. It's pretty much the same thing, because cardiovascular disease is so common and it's the #1 cause of mortality. But at the same time, if we look for early signs and symptoms, and we make changes in our risk factor and our lifestyle, we can make a dramatic impact in the long-term consequences and the results of cardiovascular disease. And that's why it's very important that we screen for heart disease, and we pay attention to our blood pressure, we pay attention to our diabetes and cholesterol control, we lead a healthy lifestyle, quit smoking, or at least try to quit smoking, and eat healthy. And all that will translate in the long-term period of time is the lower risk of having a heart attack or a stroke or losing your leg to amputation. Think of this as a long-term investment. This is slow and steady. These are not the results you will achieve over time. To make things simple, when I explain it to my patients, I tell them, hey, this is like a long-term retirement plans. You would not see overnight dramatic changes in your portfolio, but if you keep a little bit investment slowly over time, bit by bit, it adds up, and it does lead to a lower risk of cardiovascular mortality in the long run.
Is there a particular age that people should start having heart health screenings?
Generally speaking, every adult at some point, even if you haven't been to a pediatrician, generally after you switch from a pediatrician to your primary care physician, most important is to keep a good primary care physician contact, because somebody needs to check for your blood pressure, they will check for your cholesterol, and they'll screen you for diabetes. And at some point, if you have no risk factors, and they make sure, then seeing a regular primary care physician is more than enough. If you have any of those risk factors, then ask your family doctor, and then they will refer you to a cardiologist or specialist in a vascular medicine to look for more advanced cardiac diseases. So I would say if you have risk factors, then you should be a little bit more aggressive. If you do not have a risk factors, then at least have them checked once.
Does family history factor into someone's risk level for developing heart disease?
Yes. So your family history is unfortunately very important risk factors, and it's an unfortunate situation because we cannot make much changes in the family history. These are the genes that we have inherited, and yes, the risk of having a heart attack or a stroke, or other even risk factors of high blood pressure, cholesterol, diabetes, all these diseases, their risk goes up if your parents or brother, sister, or other family members have these diseases. And this risk also applies to vascular diseases. If your father or mother or your other risk parents have a history of peripheral arterial disease or poor circulation, or they have a blood clot, or they have varicose veins, that automatically increases the risk of developing of any of those cardiovascular diseases. We can't change much about family history, but definitely by changing other risk factors, we can make a major impact and a huge difference in the course of a disease over a long period of time. There's another question which is coming up with respect to why do women need to be knowledgeable about heart disease? Isn't this more of an issue for men? So as I said earlier, heart disease is the leading cause of death, not only in men, but also in women. And also at the same time, it's underappreciated. It's underdiagnosed for many medical reasons, where they have an atypical presentation. And in my opinion, also because of a social reasons, because women have more responsibility at home, taking care of kids, taking care of other family members, and a lot of times they forget to take care of about themselves. And in the midst of everything, by the time disease comes to the surface, it's kind of a little too late. So that's why we need to pay equal attention in women and men, irrespective. And actually, there are some studies and data that the mortality of heart disease or risk of death due to heart disease is higher in women than in men because of all the factors I mentioned earlier. And there's another question they're asking, what are some of the most important things that people can do to prevent heart disease? As pretty much saying what I repeated earlier, is the most important thing is the risk factor control, making sure that your blood pressure, diabetes, high cholesterol is under control. Along with that, healthy lifestyle, which includes regular exercise at least 4 to 5 times a week. A good cardio, about 30 to 45 minutes, is very important. And at the same time, eating healthy food, stay away from a lot of red meat or pork, fish, fruits and vegetables, walnuts, almonds, and a lot of nuts in our food, green and leafy vegetables, a lot of salads. All those factors play a very important role in preventing heart disease. And see your primary care physician regularly. If you have a cardiovascular disease, then see your cardiologist at regular intervals and follow all their instructions, because of these small baby steps will make a huge difference.
That's all the questions on Facebook. Do you have anything else to add?
No, I think pretty much the same. I would say don't hesitate. We've been doing it for this long time. A lot of times, vast majority of times, patients come at times when it's a little too late. And at the same time, most important, what I would say is that in addition to all the risk factors, probably in vascular disease, most important from my perspective is quitting smoking. And I know it's challenging for a lot of patients, but keep working on it. It's even a little bit difference, or even a little cutting back and taking that first step becomes very important. You always have to start at some point. So definitely from a cardiovascular standpoint, quit smoking. From a venous disease standpoint, I would say same exercise, losing weight, making sure if you're long distance travel that you're well hydrated, take frequent breaks, and if you have a blood clot, make sure that you take blood thinners, follow up with your family doctor, so that the long-term consequences of all those can be minimized. Thank you so much for having me over here, and if you have any questions, please don't hesitate to contact us. Thank you.